So over the last 24 hours, we had 17 new cases. We did 342 tests. We also currently have 7 patients in hospital, 5 of them at Ocean View. None of them right now are in the ICU, so that's a good thing. In terms of vaccination, persons 18 years and older, we have first dose administered about 446,418 doses. That's approximately 87% of our population. In terms of second doses, we have administered 346,244 doses, or 67.5% of that population. For the age group 12 to 17, we have administered 35,687 doses, so that's 48.9% of that age cohort. And for second dose, we are now at 26,181 doses. That's 35.9% of that age cohort. For persons between 5 to 11 years of age, we have administered 8,125 doses, first doses. That's about 8% of that age cohort. And second doses, we are now at 3,841 doses, or 3.8% of the age cohort. Boosters, right now, we are at 73,375 doses, or 12.5% of those who would require a booster dose. There have been a slight increase. We've seen from last week to this week 7.6% increase or so. So late night vaccine is something that we have started recently, and we have been seeing more people coming out in the evenings to get their vaccination. So the first week we've had from the 28th of August to the 3rd of September, we've seen an increase of 1,490 doses. And in the second week, we saw 1,603 doses. So there have been some amount of increase in this regard. Because we're seeing a positive uptake in the later hours, we are going to also extend this program from Region 4 to Region 6 and see whether we have similar results. So first of all, I think people ought to get boosted, because I think a large group of our population would have received at least a first or a second dose. So the thing now is to ensure that people are boosted. A lot of people who are eligible for boosters have not come back to be boosted. So if you're going to go into gatherings where there's a lot of people, the chances are you might be sitting next to someone who might be infected. You wouldn't know. So it is better for you to ensure that you're boosted. So vaccines are available for boosters. So please come in and get your boosters. If you're going to go there, you should wear masks, but a lot of people these days don't want to wear masks. N95s are better because they're more protective than the regular face masks. The other thing I think people should think about seriously is not to be in crowded areas, but again, that's a challenge, because where people would be sitting, they would be sitting next to each other, shouting and so forth, so that might be more challenging. So the better way to protect yourself really is to ensure you get a booster dose. So just in case if you do get infected, you will have a milder form of the infection. In terms of monkeypox, persons who would have rashes on their skin Might not necessarily be monkeypox, but it's advisable that you come to one of the health facilities so that a medical doctor can review your skin condition. And if they think it's monkeypox, they will do a test, and from that test we can know whether or not you're positive. If you're positive, then we have certain measures that we'll take. If you're negative, at least you will confirm that you're negative, and maybe we would be able to treat you for whatever other condition that would have caused the rash. So it's important that you present yourself, because there are many diseases that can give you rashes. It's not just monkeypox, but it's better to know and take the precautions. Persons who might be experiencing some signs and symptoms, things like fever, body aches, and things like that. If you have these types of flu-like symptoms, it's advisable to get tested for COVID. And if you do have COVID, then the better thing is to stay away from going to the cricket. I think that's important. That would help to protect people, and that would help to prevent spread.